right, ready? I can do it twice if you guys can.
Yeah. Well, I hold yours.
Ready?
Here, hold mine too.
Why didn't you get Brad? Are your hands dirty?
No.
Why didn't you give yours to Brad so he can video from that side?
Thanks.
You're my little cat tease.
No, it's not.
Why is it so blurry?
I don't know. You didn't even touch the cat.
Okay, ready? So here is the esophagus, the cartilage tube right there. The big cartilage on top is the thyroid cartilage. And then this flap right here is the epiglottis. Behind the trachea, we have a muscular tube, which is your esophagus. Okay? Take out the heart here and follow the trachea down where it splits, which I know some of you can't see, is the carina. And then on either side, we have the lungs with their multiple lobes. This muscle right here is the diaphragm. If we look at the abdominal cavity, let's look at our mesenteries first. Connecting the stomach to the liver right here is where the lesser omentum would be. Okay? This is a greater omentum. It's a mesentery. Oh, stay open. A greater omentum hangs off the stomach, which is right here, and covers the small intestines. When you pull out the small intestines, we have a mesentery that anchors them to the abdominal wall. And this is your mesentery proper. And this is what your superior mesenteric artery runs in. Lastly, anchoring the colon, or the large intestines, you piece of garbage. Anchoring the large intestines to the abdominal wall is the mesocolon. So mesentery, which is peritoneum, that anchors it to the abdominal wall. Looking at the liver here, it's multi-lobed. If we pull apart some of the lobes, we see a little gallbladder hanging out there. And then after we tore away the lesser omentum, we can see the cystic duct moving from the gallbladder, the common hepatic duct moving from the liver, and these two form the common bile duct moving into the duodenum. Here is your stomach. The small intestines are here, and then the large intestines. That's as detailed as you guys need to get. On the posterior portion of our mesentery here, it's really hard to see, but you guys see this granular substance right here? Looks like a sponge that's been flattened. This is your pancreas. And then in the upper left quadrant, they have the spleen. If we look over here, we have a kidney, which is clearly retroperitoneal, and a ureter coming from the kidney going to the bladder. Okay? They dissected a kidney. And the outside, the most outer part, is the cortex. And then the next dark part is the pyramids of the medulla. And then as we move further towards the middle, we can actually see the renal pelvis, which is right here. Renal pelvis, renal pelvis, renal pelvis. Okay? This is a female. So what you actually see here, I'm going to hold up a uterine tube. You guys see all this connective tissue here, this peritoneum? That's actually your broad ligament. Okay? At the ends of the uterine tube, there's a little ball-like structure. That's the ovary. This is the uterine tube. And where the two uterine tubes come together, it forms a little V, and that's all the uterus is in the cat, is this little V structure down here. Okay? And that's it.